Discuss the etiology, clinical manifestations, investigations, and management of von Willebrand's disease. Von Willebrand's disease is the most common congenital bleeding disorder and is transmitted in an autosomal dominant pattern. Rarely, it can be acquired also. Etiology: von Willebrand's disease is due to deficient or a defective von Willebrand factor. Von Willebrand factor is important for platelet adhesion to subendothelium. Von Willebrand factor is synthesized by megakaryocytes and endothelial cells. The gene for von Willebrand's factor is located on chromosome 12. Von Willebrand factor also acts as a carrier for factor 8 in the circulation, increasing the half-life of factor 8. Hence, in von Willebrand's disease, there may be secondarily coagulation disturbance due to decreased levels of factor 8. Clinical features: von Willebrand's disease affects both men and women. Most cases are mild. Patients present with a mucosal bleeding, that is epistaxis, gingival bleeding, and menorrhagia. Some patients may come to attention because of excessive bleeding after surgical incision or dental extractions. Bleeding tendency is exacerbated by aspirin. Characteristically, bleeding decreases during pregnancy or estrogen use. Investigations: bleeding time is prolonged in the presence of normal platelet count, defective or absent platelet aggregation. Levels of von Willebrand factor in plasma are reduced. Ristocetin cofactor test is the most specific and shows decreased biological activity of von Willebrand factor. Management: since the bleeding is mild, no treatment is necessary except before surgery or dental procedures. Desmopressin acetate, that is DDAVP, can increase the von Willebrand factor levels by 2 or 3 folds by releasing restored von Willebrand factor from endothelial cells. It can be given before surgery or dental procedures. The antifibrinolytic agent epsilon aminocaproic acid, that is EACA, is useful as adjunctive therapy during dental procedures. It is given after DDAVP, that is desmopressin acetate.